what are the prevention strategies? So I'm only going to talk about the medical interventions that have been shown to prevent cancer development. I will not talk about the lifestyle changes that lead to prevention of the cancer. So these medical interventions, some of them actually have shown to prevent cancer development. And the most important ones are the prevention of cancer that are infectious associated. So for example, HPV, human papilloma virus, causes cervical cancer in more than 90% of the cervical cancer patients, cervical cancers. It is also known to cause or being associated with head and neck or oral cavity cancers and anal cancer. HPV vaccine became available in 2006, and there was a published trial that showed in 2014 that in women who were vaccinated for HPV vaccine, the incidence of cervical cancer went down by 30%. So again, so HPV vaccine has been shown to prevent cancer development. So I would definitely recommend and giving an HPV vaccine to pretty much all the adolescent boys and girls because that does prevent cancer. Second one, which has been shown to prevent cancer, is hepatitis B vaccine and also treatment of hepatitis C. Hepatitis, both B and C is being associated with hepatocellular carcinoma, and with advent of hepatitis B, again, there is a drop in hepatocellular carcinoma. We cannot completely eliminate the other preventable causes of hepatocellular carcinoma is alcohol and NASH, which is fatty liver. And that is a preventable cause with lifestyle changes. Now, what are the prevention strategies for high-risk population? One of them is a very common thing, like use of low-dose aspirin, 81 milligrams. It's been shown to decrease the incidence of colon cancer in high-risk families with Lynch syndrome or patients who have polyposis found during the regular screening colonoscopy, or family history of familial polyposis. Here, the low-dose aspirin has shown to decrease the colon cancer development by 30 to 40%. In women who have high risk for developing breast cancer, and the high risk is actually calculated by their by a model is known as Gale risk model. It includes family history of breast cancers, some benign breast cancer disorders, the age of the first childbirth, and the age that they started having periods, and age of menopause. So all of these factors are put into this Gale model risk, and we calculate the risk of developing breast cancer in the next 5 years and lifetime development of this. So if the risk is over 1.6 over next 5 years, or lifetime risk is over 20%, these patients actually, in these patients, use of tamoxifen can reduce the risk of development of breast cancer by 50%. And we actually use tamoxifen to reduce the risk in high-risk breast cancer, high-risk women for breast cancer. Other one is in women who have been diagnosed with a BRCA1 or 2 mutation. Preventive mastectomy, bilateral preventive mastectomy, and removal of the ovaries, called oophorectomy, would reduce the risk for development of breast cancer and ovarian cancer.